Every year, millions of Americans develop heart disease without realizing it. The scary part is that the heart often sends warning signs weeks, months, or even years before a serious event like heart failure or a heart attack. Most people mistake these symptoms for aging, stress, or simply being out of shape. But ignoring them could allow the problem to worsen until it becomes a medical emergency. In today's video, we'll discuss 5 warning signs of a weak heart that you should never ignore. If you or someone you love experiences any of these symptoms, knowing what they mean could make all the difference. Your heart is a powerful muscle that pumps oxygen-rich blood throughout your body every second of every day. When it begins to weaken, it struggles to deliver enough blood to your organs and muscles. To compensate, your body starts sending signals that something isn't right. These warning signs may appear gradually, making them easy to overlook. Having one of these symptoms doesn't always mean you have heart disease. However, if the symptoms are new, persistent, or becoming worse, they deserve medical attention. Early diagnosis gives doctors the best chance to treat the problem before permanent damage occurs. One of the earliest and most common warning signs of a weak heart is shortness of breath. Many people first notice it while climbing stairs, walking uphill, carrying groceries, or doing activities that never used to be difficult. As the condition progresses, some people even become short of breath while resting or lying down. Why does this happen? When the heart cannot pump blood efficiently, blood begins to back up into the lungs. This allows fluid to build up inside the tiny air sacs where oxygen normally enters the bloodstream. As a result, breathing becomes more difficult because your lungs can no longer exchange oxygen as effectively. Some people describe the feeling as not being able to catch a full breath. Others say they feel winded after only a short walk or become unusually tired during everyday activities. If you suddenly develop severe shortness of breath, especially if it occurs together with chest pain, dizziness, or fainting, seek emergency medical care immediately. These symptoms could indicate a life-threatening heart problem. The second warning sign is swelling in your legs, feet, or ankles. Many people assume swollen feet are simply caused by standing too long or getting older. While that can sometimes be true, persistent swelling may also be a sign that your heart is no longer pumping blood effectively. Here's why. A weakened heart struggles to move blood forward through the body. This causes blood to back up in the veins, increasing pressure inside the blood vessels. Eventually, fluid leaks out into the surrounding tissues, leading to swelling, also known as edema. At first, you may notice that your shoes feel tighter by the evening or your socks leave deep marks around your ankles. Some people find that rings become harder to remove because fluid is also collecting in their hands. As heart function continues to decline, swelling may spread higher into the legs and can even be accompanied by rapid weight gain caused by fluid retention rather than body fat. If swelling appears suddenly, becomes severe, or occurs together with shortness of breath, don't ignore it. Your healthcare provider can determine whether your heart, kidneys, liver, or another medical condition is responsible. The third warning sign is a rapid pounding or fluttering heartbeat, also known as heart palpitations. Most people experience an occasional skipped heartbeat, especially during stress, after drinking too much caffeine, or following intense exercise. These brief episodes are usually harmless. However, frequent or unexplained palpitations may signal that your heart is working harder than it should. When the heart muscle becomes weak, it often tries to compensate by beating faster to maintain blood flow throughout the body. In some cases, changes in the heart's electrical system can also trigger abnormal heart rhythms, known as arrhythmias. You may feel like your heart is racing, pounding against your chest, fluttering, or even skipping beats. Some people also experience dizziness, lightheadedness, unusual fatigue, or feel as though they might faint. If your heartbeat suddenly becomes very fast, irregular, or is accompanied by chest pain, severe shortness of breath, or fainting, seek emergency medical care immediately. These symptoms may indicate a dangerous heart rhythm that requires urgent treatment. Difficulty lying flat to sleep. The fourth warning sign often appears at night. If you become short of breath whenever you lie flat in bed and find yourself needing 2 or 3 pillows to sleep comfortably, it may be more than a simple sleeping problem. Normally, your heart easily handles the blood returning from the rest of your body while you're lying down. But when the heart is weakened, that extra blood can back up into the lungs. As fluid begins to accumulate, breathing becomes more difficult. Many people notice that they wake up suddenly during the night, gasping for air, and have to sit upright or stand for several minutes. before their breathing improves. This symptom should never be ignored, especially if it develops gradually or occurs together with swollen legs or persistent shortness of breath during the day. It may be one of the clearest signs that your heart is struggling to keep up with your body's needs. The discomfort may last for several minutes or come and go. It can also spread to the shoulders, arms, neck, jaw, or back. Some people notice it during physical activity or emotional stress, while others experience it even while resting. Heart-related chest pain happens because the heart muscle is not receiving enough oxygen-rich blood. This can be caused by narrowed or blocked coronary arteries and may be a warning sign of an impending heart attack. Heart-related chest pain happens because the heart muscle is not receiving enough oxygen-rich blood. This can be caused by narrowed or blocked coronary arteries and may be a warning sign of an impending heart attack. If chest pain lasts longer than a few minutes, returns repeatedly, or occurs together with shortness of breath, cold sweating, nausea, dizziness, or pain spreading to the arm or jaw, call 911 immediately. Do not attempt to drive yourself to the hospital. Prompt treatment can save heart muscle and may save your life. Your heart works every second of every day without asking for a break. The least we can do is listen when it starts asking for help. Remember, the 5 warning signs we covered today don't always mean you have heart disease, but they should never be ignored. Early diagnosis and treatment can prevent serious complications and, in many cases, save your life. If you found this video helpful, please take a second to like this video. It tells YouTube to share this information with more people who may not realize their heart is already sending warning signs. Subscribe to Smart Healthy Seniors for trusted, easy to understand health information designed to help you stay active, independent, and healthy for years to come. We publish new videos every week covering heart health, healthy aging, nutrition, and the latest medical advice explained in simple language. Finally, share this video with your family, friends, or anyone over the age of 40. You never know whose life you might help protect. One simple share today could encourage someone to recognize a warning sign early and seek medical care before it's too late.